It's the PainExam podcast with your host, David Rosenblum, MD. If you treat pain or have an interest in pain management, join us as we discuss painful disorders, alternative treatments, practice management, and more. Be sure to subscribe to the PainExam newsletter at PainExam.com and review the podcast on Stitcher or iTunes. Our high-yield premium episodes are now available on the PainExam app with a premium subscription or access for free with a CME subscription at PainExam.com. And now, without further ado, here's your host, Dr. Rosenblum.
Welcome back. We have a busy month. I'm going to be teaching ultrasound at Florida SIP, and then the week after that, I have a regenerative pain medicine ultrasound course on September 28th and 29th in New York City. I hope you can make it. You can register at nrappain.org, and I officially closed down the old PainExam site. It's now all on the new site, nrappain.org. You could still type in PainExam.com if you're looking for board prep. It'll take you to the same place. And the boards are coming up, so I wish you all the best of luck. We have a lot of docs on the website who are taking advantage of the virtual pain fellowship, which also includes regenerative medicine as well as ultrasound training online. In addition, I do have an upcoming webinar with Claris Ultrasound, and we're going to be doing a webinar dedicated to the cervical spine, scanning anatomy, targeting injections, etc. So I think you should check that out. It will be probably in December. We didn't film it yet, so I'm really excited about that. And this podcast today is really interesting. I ran into a gentleman at a restaurant. I was by myself eating by the bar, and he was there as well. I was traveling. And he works in Japan doing, research or developing the field of hydrogen, or molecular hydrogen in the treatment of all sorts of health problems, but of course, the topic of pain management came up, and he mentioned that there's evidence that hydrogen can be a therapy for pain. And I was a little shocked because maybe I'm ignorant. Maybe you all know this, but I didn't. And when I hear this, you kind of lump it into the category of like lasers and magnets and all these weird things that do have some evidence to back it up, but still not really mainstream. Anyway, there is a conference today online, September 12th. You're probably not going to get this podcast in time. That is all about hydrogen and the way its applications, evidence, etc. So I did find some article, which I'll post for you guys, going over it. And they're talking about the potential use of molecular hydrogen, H2, as a new therapy for neurological disorders. In animals, it's been proven to treat pain, specifically neuropathic pain, and they mention that there's possibly anti-nociceptive, antidepressant, and or anxiolytic actions of hydrogen that can persist during persistent inflammatory pain that has not really been investigated. So they're looking into that, and they're using male mice with chronic inflammatory pain incited by subplantar injection of complete Freud's adjuvant, which can induce arthritis or pain. It's a suspension of heat-killed Mycobacterium tuberculosis. And anyway, they injected these mice with this to create, a pain state model or situation. And they assessed the actions of hydrogen-rich water, HRW, systematically administered on the nociceptive responses and affective disorders associated, and the oxidative, inflammatory, and apoptotic changes provoked by the complete Freud's adjuvant in the pause and the amygdala. The role of the antioxidant system in the analgesia induced by the hydrogen-rich water systematically and locally administered was also determined. The results reveal that intraperitoneal administration of the hydrogen-rich water, beside reducing inflammatory pain, also inhibited the depressive and anxiolytic-like behavior associated with the overexpression of the 4-HNE, basically the genes related to the anxiety, oxidative, inflammatory, and apoptotic changes. So the data revealed that analgesic, antidepressant, anxiolytic actions, of the hydrogen-rich water, the protective, anti-inflammatory, antioxidant qualities of the treatment during inflammation were demonstrated. And you could read this whole article at your own, but kind of interesting. And you wonder how this stuff works. And so the article goes into the relationship between oxidative stress and inflammation with depression and anxiety that can be all connected, mood disorders, etc. They mentioned that over the last few years, the researchers did demonstrate beneficial effects of molecular hydrogen, there's plenty of references. There's numerous studies proposing the use of H2 as a therapy because of its facility to cross the blood-brain barrier and penetrate cell membranes. There's lack of evidence revealing undesired side effects or the development of tolerance induced by repetitive treatments. The antioxidant actions of this molecule against various oxidative-related diseases has been demonstrated, and the antioxidant effects of H2 are predominantly adjudicated to its capacity to incite the translocation of the NRF2 transcription factor from the cytosol to the nucleus, with the following transcription of several genes, such as superoxide dismutase, hemoxygenase, which is, by the way, something I did research on as a college kid, so it's nice to hear that name again, and NADPH quinone oxoreductase 1. This is really basic science stuff, or I don't know if it's basic, but this is really molecular stuff that, these are words I don't use every day, so forgive me. Anyway, studies have shown the anti-inflammatory response induced by H2 through inhibiting pro-inflammatory cytokines, for instance, interleukin 1b, IL-4, IL-5, and IL-13, among others in the last years. The potential antidepressant or anxiolytic effects of H2 have also been shown in animals with unpredictable mild stress and in healthy patients. All these attributes suggested that the H2 might be a good candidate for treating pain and linked affective disorders. Consequently, several authors have revealed the painkiller properties of the gas in animals with neuropathic pain. Even so, it's possible anti-nociceptive, antidepressant, and or anxiolytic effects during chronic inflammatory pain have not been completely established. So in mice with chronic inflammatory pain provoked by the CFA, that's the solution, they evaluated the anti-nociceptive effects with intraperitoneal injection or subplantar administration of hydrogen-rich water. So, I mean, in your practices, subplantar definitely is a lot easier than intraperitoneal, right? We're not doing many intraperitoneal injections in our offices. The feasible antidepressant anxiolytic effects of hydrogen-rich water during chronic pain were mentioned. And so it just, I'm not going to get much more into this article because you can read it yourself. I mean, bottom line, this is just a new therapy that seems safe. I still have not seen enough data on it to start injecting people with hydrogen, and definitely not injecting them in their peritoneum space. But this is, a safe new way to treat pain is always exciting, right? Especially this one comes in the form of, I think they could just drink the water, or you can inject it, or you could, I'm still learning about this stuff. So I'm not telling anyone to go out there and start using this stuff, but I think we should all start looking at it and following what's going on in the data. This is a lot of international work going on here, and it's something that may one day be standard of care, or maybe one day it'll be a thing like, PRP, or who knows. I mean, in the meantime, keep your ears open, and perhaps this summit that's happening today does have a replay of the webinar in case you missed it. And if you're interested, it's called H2 Summit by MHI. And I think MHI is a Molecular Hydrogen Institute.org. So you could check them out, see what's going on. But I think this is exciting stuff. Always, if it's safe, it's new, and it works. And of course, I'm sure the insurers are not going to pay for this anytime soon, so it's probably going to be something that patients are probably going to have to pay cash for. But anyway, I just figured I would let you in on something I heard about. Maybe it's going to be nothing. Maybe it's going to be amazing. Who knows? And I hope to see you at the upcoming courses. Remember, on September 28th, 29th in New York City, regenerative pain medicine and ultrasound guidance. I think my next course after that will probably be in December. I'm going to take a break for a little bit, but just check the nrappain.org website, the list of events and calendars there. Also, if you know anyone who needs ultrasound IV training, I have a course in New York City, September 18th. If you hear this by then, if not, I'll probably have other dates added to the website. So looking forward to seeing you guys. Thanks for listening, and good luck on the boards.
Dr. Rosenblum is here solely to educate, and you are solely responsible for all your decisions and actions in response to any information contained herein. These podcasts are not intended as a substitute for the medical advice of a physician to a particular patient or specific ailment. You should regularly consult a physician in matters relating to yours or another's health. You understand that this podcast is not intended as a substitute for consultation with a licensed medical professional. Copyright 2017, David Rosenblum, all rights reserved. No part of this publication may be reproduced, stored in a retrieval system, or transmitted in any form or by any means, electronic, mechanical, recording, or otherwise, without the prior written permission of the author.